So I want to welcome you all here this evening to this Center for Christian Engagement event. I'm John Martins, the director of the Center for Christian Engagement, and I want to welcome all of you who are here in person, and to those of you, the many of you who are joining us online, we welcome you all. And I'm welcoming you to the lecture, We Know That Thou Shalt Nots, but What Shall We Do? The Changing Face of Catholic Moral Theology, which will be offered by Father Mark Miller, Visiting Scholar of Ethics for Providence Healthcare and St. Mark's College this academic year. And the principal of St. Mark's College and president of Corpus Christi College, Dr. Jerry Turcott, will be introducing our guest lecturer shortly. I want to thank you for traveling to be with us on our beautiful campus on the land of the Musqueam people. For the land on which we gather is a traditional, ancestral, and unceded territory of the Musqueam people. We're thankful for their welcome to us. And I want to offer a little bit of gratitude as well, not just to the Musqueam people for whom we are so thankful, but for the Cullen family, Mark and Barbara, for their generous support of our lecture series, and we're thankful for that constant support. Also want to thank the donors to our center, Peter Bull, Angus Reed, and Andy Zox, and we're thankful for their commitment to our center. And thank you also to a number of you who have donated to the CCE and to this lecture when you registered. We really appreciate that. I also want to remind you, and maybe this is most significant if you're from Northern Europe, but today is St. Nicholas Day, and it is St. Nicholas Day celebration. So we're going to have mulled wine, we're going to have gingerbread cookies, we're going to have other dessert treats. If some of you have ever celebrated St. Nicholas Day, you know on December 5th, the kids put out the shoes or the boots. They wake up, they get chocolate, nuts, that sort of thing in their shoes. So we're going to celebrate with you this evening after the lecture, so please do stay for that as well. For those of you at home, you have the comfort of your home, you don't get the mulled wine. And the treats, I apologize for that. Now it's my great pleasure to introduce Dr. Jerry Turcott, who will introduce our esteemed visiting scholar. Thank you.
Well, thank you, John, and good evening, everyone. It is my very great pleasure to introduce our guest of honor this evening, Father Frank Miller, who, as John says, is the 2023 Visiting Scholar in Ethics for our remarkable partnership between St. Mark's College and Providence Healthcare. Father Mark was ordained in 1975 as a Redemptorist priest after studies in Winnipeg, Toronto, and West Germany. Father Mark worked with many young people for 6 years, followed by the preaching of parish missions for over 7 years. After receiving a doctorate in moral theology from the University of Notre Dame, he spent 16 years as a clinical bioethicist at St. Paul's Hospital in Saskatoon and for the Catholic Health Association of Saskatchewan. In 2008, he moved to Toronto as part of the leadership team under Redemptorists, but continued his work in Catholic healthcare ethics at the Center for Clinical Ethics. He's taught and provided workshops at Catholic colleges, in adult formation programs for Catholic teachers, and for many, many healthcare practitioners. He's passionate about the gospel call to the ministry of healing, to Catholic and faith-based healthcare, the palliative hospice care, and to parish nursing. And he brings significant experience and expertise to us as our visiting scholar. And I will say, as having had the pleasure of knowing him for this brief time, he also brings an incredible wit and humor to his work, which is very appreciated by our community. And he's promised to be extremely funny tonight on this. So this evening's talk, as you've heard, is We Know That Thou Shalt Nots, but What Shall We Do? The Changing Face of Catholic Moral Teaching. Could you please join me in welcoming Father Mark Miller.
Well, I can never resist a challenge. And you may have heard this before, but one of the things that the Second Vatican Council did was it invited moral theologians to be much more scriptural in their presentations and in their reflections. And I don't know if you've heard this story about Joseph of Arimathea. Joseph of Arimathea was the one who provided his tomb for Jesus. And the story, it's not in the Gospels, but I'm sure it's not very far away. The story is that Joseph went home on Good Friday after burying Jesus in the tomb. And he went to his wife and he said, "You know, dear, You remember that tomb that we spent 2 years looking for and a huge amount of money carving out so that we'd have a place to rest in our once we died? His wife, very suspicious, said, yes. He said, well, I gave it to Jesus because he had nowhere to lay his head after he died on the cross. And she got furious. She started in on him. How could you do that? You spend thousands of pounds on this thing, and we spent 2 years looking for this, and we finally got the perfect spot, and you give it away. And Joseph turns to his wife and he says, now, dear, please calm down. It's just for the weekend. I've done so many Zoom meetings over the last little while, I don't dare tell jokes because I can never see anybody laughs. So thank you for that. I'd like to begin with a little bit of an explanation of some of my own background. In 1988, I was asked to go and get a doctorate in moral theology, and I was very fortunate to be able to enroll at the University of Notre Dame, which at that time was probably one of the premier schools, certainly in North America, when it came to theology and moral theology. One of the professors there was Dr. Richard McCormick, a Jesuit who was a very prominent ethicist, and one of the reasons why I went there. During the very first semester, we had a course with Dr. McCormick, and there were 11 of us students, and we would go to he had a little house where he would gather his students, and we would go and sit in the living room, and we would talk about the issues that were on the agenda. And I would guess that a third of our conversations in that first semester were on Humanae Vitae, which, for those of you that don't know, was the encyclical that was put out by Pope Paul VI in 1968, which prohibited the use of artificial contraception. And what had happened since 1968 was a huge uproar in the church. There were many theologians that were opposed to this. There were bishops and bishops' conferences that put out statements that tried to soften it a little bit and make it easier to adjust to. And there was a reaction in the Vatican that got particularly strong after 1979 when Pope John Paul II stepped into the office. And what was interesting for me was we spent so much time fighting over whether this made sense or not, this moral teaching. And one of the things that kind of struck me was we were trying to get the law as clear as we could so that we could give clarity and we could give a kind of a sense of rightness to the people that this was meant to serve. And quite frankly, we never got there. The battle went on and continues in some ways up to this day. But it raised a whole pile of questions in my mind and in the minds of many other moral theologians about what we're trying to do in the world of moral theology. Now, moral theology as a phrase is very Catholic. When we talk about Christian ethics, we talk about all the different Christian denominations and the way they think about ethical issues. In Catholic theology, moral theology was our particular way of approaching ethical issues and coming to conclusions. But you're going to hear me over the course of this talk move from the term moral theology to the phrase Catholic theological ethics. And I will explain that later on why this is such an important change in our world today. But what I'm going to do is I'm going to try to do 4 things tonight if I've got enough time. The first thing I want to do is go back in history to see where our understanding of moral theology has come from. Now, one of the things to understand is that at the time of the Second Vatican Council, moral theology had been focused in on what they call the manualist tradition. These were priests, for the most part, that would write basically what all the various sins were, how serious they were, and what the punishment should be for them. And the manualist tradition was very fixed, very much put in place, I suppose in a sense for eternity. It was like the rules were clear and you just had to follow them. But there's a history to that. And I think it's really important to understand some of that history. So that's the first thing that I'm going to do. The second thing that I will do is I'm going to speak about the situation of moral theology at the time of the Second Vatican Council and shortly thereafter, and why it was so upsetting the way things were or were not dealt with. And then I want to speak a little bit about the new faces of moral theology. What's happening in the church, especially over the last 25 years, as we move in directions that are quite different from what happened before and at the Second Vatican Council. And then I'm going to draw some conclusions or some consequences, if you will, of where this reflection is going to take us. So let's begin with the history of moral theology. Moral theology didn't sort of start at the time of Jesus and then it kind of develop and unfold. At the time of Jesus, there was an expectation that he would return very quickly, and you can see that in Paul's letters to the Thessalonians, where he's trying to calm them down because people are dying and Jesus hasn't returned yet. But the biggest problem that they had in the early Christian communities was the problem of people being baptized, having all of their sins taken away, and then committing more sins. And what do you do with those? Well, you've been baptized, you can't be rebaptized, so what happens? Well, over about the first 4 centuries, what developed was gradually become known as public penance. There were 3 sins that that were debated about in the early church, whether you could even get forgiveness for them: murder, apostasy, and adultery. But gradually, if you were willing to at least admit that you had sinned in one of these ways, there was the possibility of a public penance. So you would be dressed in a certain sackcloth and ashes, and you'd be put in a certain part of the church. You couldn't participate in the Eucharist except from this distance. And the idea was that you would do penance, and I'm talking about 14 years. This was serious stuff. But it was also embarrassing, and it was not the kind of thing that most people were willing to admit to. The first change began after the Irish monks began to develop what we call penitentials. And penitentials were books to identify not just sins, but to identify temptations, let's put it that way, and how to deal with them. And the reason that they developed is because at the 5th century, there were all kinds of monks that were starting to establish foundations in Ireland. And when they established foundations in Ireland, there were a lot of young, naive monks, sort of fleeing from the world and finding a place there. And they were often lost. They might then say, well, I'm having a horrible time with my prayer. How do I find some assistance with prayer? Well, you'd go to one of the older monks and you'd say, can you help me to maybe get over these temptations? Or can you help me with my dryness, or whatever it might be? And then a whole pattern began to emerge of this sort of spiritual direction. And in order for the spiritual direction to be codified, it was put into books called penitentials. And the penitentials were then used when the Irish monks began to catechize in the northern French and Germanic areas, and they would bring with them this opportunity for confession. Confession being that they could admit to the things that they'd done wrong, and then they would get some advice on how to improve their lives, how to become, if you will, more Christian. What was interesting was that this whole pattern of private confession began to spread through the whole church. It spread because it was so much easier and so much more respectable, if you will, than public confession. And it particularly became a part of the monasteries that were basically where Christian civilization continued after the destruction of the Roman Empire and before the great era of the cities in the 11th, 12th, and 13th centuries. But what happened was the penitentials became focused more and more on, if you will, the sins of the monks, some of which were, of course, the sexual sins, whether it was masturbation or homosexual acts, and how serious these were. And it became a manual, for the most part, within the monasteries, until you started to see lay people looking for spiritual direction. And the monks would then give them the guidance that they needed based upon their experiences and their own interpretation of these penitentials. What was interesting, however, was that in 1254, Innocent III, the Pope at that time, mandated that all Christians now have to do their Easter duty once a year. You have to go to communion, but to go to communion, you have to go to confession. So now confession started to spread through the whole of Christendom, and it became part and parcel of the ministry, particularly the Dominicans and the Franciscans, who arose in the 12th century and began to preach in the cities, this great phenomenon of urbanization. So what you see is this movement towards a penitential guidance, if you will, that is beginning to penetrate all of Christianity. Now that's just the first movement. It's what we call the Irish penitentials and then the penitentials in the monasteries. The second movement in history, which is really important to understand, is what happened when the scholastic theologians began to think about these things and debate about these things and began to talk with one another about the realities of sin, of repentance, of mercy and forgiveness. And rather than go into a sort of a detailed presentation of them, I just want to talk for a little bit about St. Thomas Aquinas. As most of you are aware, St. Thomas wrote his famous Summa Theologica, or the sum of all theology. But the reason that he wrote it was not to sort of show that he was bright and he could kind of put all these things together in this massive set of tomes. What he was trying to do, and this comes from an article by a Canadian by the name of Leonard Boyle, who worked in the archives in the Vatican for quite a number of years. And he went back and he started to study St. Thomas, and he began to understand that what St. Thomas was trying to do was make it very clear what our theology was about God. That's where he starts, about Jesus, the Christ that comes to us, and then about our humanity and what we are in the image of God and what that should mean for us. And what's very interesting is that Thomas did all of this in public disputations. In other words, he didn't just get up and lecture, and this was the final word. He got up and he got into conversations, he got into dialogues, he got into fights, and this was a normal way of doing things among the scholastics. They were very much, if you will, a debating society, because there weren't nice, fancy, easy answers around, and so you'd get different opinions on different sides of things, and they would battle these things out. And to show you how serious they would get about them, at one point, well after his death, the writings of St. Thomas himself were condemned by the Archbishop in Paris, as if the Archbishop's opinions were the most important ones. But what I want you to understand here is the penitentials, the Irish penitentials, began as a form of spiritual direction and became focused on the temptations and the sins that people struggle with. The scholastics began to focus on systematizing our understanding of these theological realities, sin and redemption, mercy and the like. But gradually what happened was, as the scholastics pulled these things together and the battles deepened, you moved on to another tradition. And the other tradition was what we call the nominalist tradition. According to St. Thomas, for example, and most of the scholastics, what you wanted to do was establish principles that were very generic, and then they would apply to the situations that people were living. But you had to apply the principles. St. Thomas, for example, argued that the very generic principles, the only principle that I think St. Thomas would have said was universal and absolute, is do good and avoid evil. Now that was before Michael Jackson said, I'm evil, and he meant I'm good. But what he was trying to get across was that you take these generic principles, and then when you start to apply them, you've got to see how they fit in the circumstances of the individual situation. But it is a process to a great extent of deduction, but it has to be adapted to the circumstances, to the intentions of the actors, and so on and so forth. And he would put a statement on his most generic principles, like thou shalt not kill. It holds, and the Latin phrase was ut in pluribus, which means for the most part. When you say, well, thou shalt not kill, you'd think that would be an absolute dictate for the Gospels, but it's not. It's not, for the very simple reason that sometimes we justify killing. Things like self-defense, capital punishment, a just war, even today in what we call indirect abortions. Those are ways of saying, well, there are exceptions. Others will say, well, those are not exceptions. We need to make the rule a little clearer, and I'll explain that in a few minutes. But what was interesting was that St. Thomas and the other scholastics were trying to establish these generic principles, and then they were developing something that was really profound in their theology, which was a whole sense of the virtues by which you apply principles to the specific circumstances. Let me give you an example of this. The example would be, for us today, would be a physician. A physician has a principle that I cannot perform any act of intervention on the body of my patient without their informed consent. So the physician gets informed consent to do some kind of abdominal surgery. The physician gets in there, the surgeon gets in there, and he starts rooting around, and all of a sudden he realizes that there's a cancerous lobe on the liver that nobody had seen before, that has the potential to metastasize. He doesn't know whether it's problematic or there are other problems, but he knows that this has to come out. Theoretically, if you follow the law would state very simply that you would have to seal her up, close her up, and then wait till she wakes up, and then ask her, would you be willing to give us permission to go in and cut the cancerous lobe off of your liver? Now, there were lots of people that would say that's what you have to do because that's the law. But there's a whole other group, and I think St. Thomas would be in that. St. Thomas would say, you've got to make prudential decisions. Prudential decisions are the decisions of wise people who have had experience with these kinds of things. And what they do is they draw a conclusion based on analogies to other circumstances or situations. So there's no nice, neat, clear answer. You have to try and derive the answer as best you can by not a deductive logic, that's already got you there, but by an inductive logic based upon how you put different cases together. And if you were that person who just got carved open and woken up and told that you had this cancerous lobe on your liver, what would you say to the surgeon if the surgeon said, no, I couldn't touch it because I didn't have your permission? Basically, most of us would say, well, you didn't need my permission because it was fairly obvious that that's what you should do. But you're going to see how this plays out in two very different ways of doing ethics, particularly in our church. But what I want to emphasize, just, and I'll get back to this in a few moments, is that St. Thomas, when he started to talk about ethics, he didn't talk about laws. He talked about virtues. And what he was interested in was his theology was to unfold in such a way that people who read it and people who followed it, including the priests who would administer it in the sacraments, that they would understand that what we're trying to do is to create Christian disciples. And what that means for St. Thomas is that the interior person is to be formed in such a way that our external actions flow from these good virtues that we've built into our lives. A couple of examples. Suppose I wish in the name of the gospel to be generous. Well, then I'm going to cultivate the virtue of generosity. And when I come across a situation that requires generosity, I don't spend a half an hour thinking about it. I just am generous. You can multiply that by compassion. You can multiply that by even a virtue like listening. And St. Thomas has a whole structure of virtues. He has the three theological virtues, faith, hope, and charity, that are infused, and then the moral virtues of justice, temperance. I always get stuck on these four, but you'll find them sooner or later. And what's interesting is what he does is he unfolds this as a way of us living the gospel. And so for morality for him is not a question of putting down the sins, it's a question of whether we're going to be disciples and how we're going to build that into our lives so that it overflows into our actions. Then, in his Summa Theologica, when he's done his huge tract on the virtues, he asks the question, what about the law? What does the law do for us? And he seems to say very simply, the laws are our attempt to use human wisdom and understanding to help us deal with really difficult situations when our virtue doesn't make it clear what we're supposed to do. So for Thomas, the law needs to be, if you will, human wisdom in written form that's going to help us, not that dictates to us. And there's a real parallel here with Paul's struggle with the law when he becomes a Christian. For Paul, the law is an oppressor. The law is something that you have to follow, and if you don't, you're not righteous. Thomas has kind of the same feel to his. The law is important. The law needs to be understood, but you need that gift of prudence to apply the law to a particular circumstance. And that holds ut in pluribus. Now, I could go on and on about Thomas and the scholastics. I'll come back to him in a little bit, but I want to go on to the next stage in the history of Catholic moral theology, because the next stage begins with what we call the nominalists. And I've always had a trouble understanding what we mean by nominalists, and I finally got a bit of a clarity on the thing. A nominalist like Duns Scotus or William of Ockham basically says, forget about those big fancy principles and forget about Plato's forms. Plato's forms would state that there is something called humanity out there which you and I all somehow collaborate in because we have the form of a human being. The nominalists say that doesn't hold. There's nothing out there called humanity. There are only humans, and we name them humans because they look like humans. So the nominalists are those that just name the particulars. Now the beauty of this is they get away from some of those really dramatic principles that seem to constrict people without taking into account their circumstances. And they become the groundwork, if you will, of what we call the casuist tradition. So that's the third stage. The casuist tradition is when you've got moral theologians who are dealing with the issues that are popping up and things that are happening in people's lives, whether it's the shepherds out in the field or the people in the cities. There's all kinds of new things popping up, and now they're debating with one another about how serious these things are and whether they are sinful or not, and how serious, and so on and so forth. And the beauty of the casuistry is that it's a debate among these theologians who often have great practice and experience in dealing with their people. A great example of this is St. Alphonsus Liguori, who's the founder of the Redemptorist order to which I belong. And St. Alphonsus was a scrupulous man. He often suffered terribly because of his own sense of failure and breaking the rules. But he was a lamb when it came to penitence. And when he wrote his Theologia Moralis, his summary of morality, he made it abundantly clear that what he was trying to do was look at all the different manuals on moral theology and take from them the best arguments he could for each position that he would take a stance on. And at one point, he makes a very interesting statement. He's not making this about the Pope, he's making it about other moral theologians. There were moral theologians that had great status and great authority. And at one point, St. Alphonsus says simply, I look at the arguments and I always give precedence to the arguments over authority. So just the fact that Busenbaum has said that doesn't convince Alphonsus. And there's a real struggle here that you're going to see starting to surface after the manualist, or after the casuist era. Again, so there's three things here to keep in mind, and these are going to affect us in our modern moral theology today. The Irish penitentials and spiritual direction, the scholastic debates about the rightness or wrongness of particular situations and actions, and now the casuists debating among themselves. And one of the things to be aware of is that among the casuists, there was this great debate about, well, who are you supposed to follow? If you've got all these different opinions, what are you supposed to do? The Jesuits came down on the side of what was called probabilism. What that meant very simply was if you had a probable opinion, you could follow it. But there were at the time very, very strict Jansenists, and they were not impressed with the Jesuits, and they would make all kinds of complaints that this was way too easy on the people, and you had to be a lot tougher on the people, and they were what were called the rigorists. So they started to decide that maybe probabilism wasn't good enough because probabilism allowed you to take a probable opinion from somebody who really wasn't a very good moral theologian. And then they started to talk about probabiliorism, which is the Latin word for more probable. So now you have to try and choose the more probable opinion. You can imagine lay people trying to sort these things out. What they're basically doing is going to the priest and saying, what can I do this? Can I follow this? And the priest is the one that's responsible for finding out how serious it is. Now, probabiliorism didn't go over very big with some of the others, like St. Alphonsus. St. Alphonsus, trying to walk a very careful line between what they called the laxists and the rigorists, established what he called equiprobabilism, which meant very simply that any seriously probable opinion could be followed. And what he was trying to get at was, if the law isn't 100% clear, you have to follow your conscience to the best of your ability. Now there's another side to that where even if you're wrong, you have to follow your conscience, but I won't go there just yet. But what's important to understand in this is, once again, what St. Alphonsus was trying to do was to encourage within the heart of the penitent an awareness of the mercy of God, the gentleness of God. In fact, Alphonsus wrote all kinds of other things besides his moral theology, devotional literature, songs, hymns. He did paintings, all about this great Neapolitan devotion to Christ and to our God. And it was this mixture of his devotion and his moral theology that gave him a tremendous sense of compassion for his people, mostly the shepherds and the poor people in the countryside. But he learned from them. He learned how hard it was in their lives, and he adapted his moral theology because he learned to listen to them. And what was interesting for me, at least, was that he never, well, may sound strange to you, but he said at one point near the end of his life, "I have never refused absolution to a penitent." Now that may sound strange because we don't do that very often, but at his time, there were lots of rigorists who would say, well, he went to confession, but it really didn't strike me that he had the right intention, so I refused absolution. And Alphonsus' response to that was to say, the very fact that somebody shows up for the confession means that they are intending to ask God for mercy. And our job is to express that mercy of God that is endless. And that was the casuist pattern. However, things changed in 1650. 1650, there was a book published by John Mayer, or John Major, depending upon your pronunciation. John Major produced a manualist book based upon the casuistry, but he didn't put the arguments in, he just put the conclusions. So now we've got the sins, and these are the sins, and you don't have to explain them, these are the sins. That's all there is to it. And what's interesting is this took over for the next 300 years, the 300 years before the Second Vatican Council. All the priests needed to know was what the sins were, and then you could deal with them in the confessional. But notice what happened. All of the sins now are clear. They're fixed in place, and they start to become everlasting. What I mean by that is, you've probably heard the phrase, the church has always taught this. That became the mindset. They weren't thinking of history. The mindset was, that's the way the church has always taught this, therefore these are unchangeable. And you may, well, you probably don't, but you may have heard at some point that there's this thing called papal infallibility. Well, at the First Vatican Council, when papal infallibility was made, it was made about the Latin phrase is fides et mores, which should be translated faith and customs. The Pope is never going to be make a mistake when he comes down in an infallible statement on faith and customs. However, fides et mores became translated as faith and morals. And over the 300 years of the time before the Second Vatican Council, popes started to intervene on a lot of these cases, and they did so because there was this understanding among moralists that there were two things that were necessary to make sure that a sin was a sin. One, it had to be against the law, so you needed a law, but the law needed to be promulgated. It needed to be stated by somebody who's in authority, and that became the Vatican. And so as you got closer to the Second Vatican Council, you got things like Pope Pius XII, who over his lifetime pronounced in over 1,000, you wouldn't call them conferences, he would talk to people, like he'd have the midwives of Italy to come, and he would speak to them, and if there were any controversies that some of his canons talked to him about, he would give answers there, and then that would become the final answer for the whole church, basically. And by the time we got to the Second Vatican Council, the laws and the rules were very strict, but they were very, very calcified. They were in place. And as a result, you had this idea that the church simply teaches morality. Unlike the rest of the people who are all relativists, we teach you the truth. You now have certainty. You can follow these rules, and that's the end of it. But there were problems. And the problems were that this became, if you will, a bit of a moral pathology. What I mean by that was a focus on sin and sins and all of the problems that go with that. So, where do we go from here? Well, let's take a quick look at the Vatican Council and the state of moral theology at the time of the Second Vatican Council. As I said, it had 300 years of being fixated in place around the sins that were now very clear, at least to the confessors. There was a great similarity to canon law at that time. Canon law and moral theology have diverged since then in some ways. But canon law was geared towards making sure that you had clear answers to difficult questions that arose in the church. So whether it's the appointment of a bishop or God knows what, canon law was aimed at trying to give clarity in those circumstances. Moral theology was trying to do the same thing in the realm of morality. But the interesting part about this was that the issues could not be questioned. Once they were decided, that was the end of it. And sometimes you'd get these really interesting turns in something that would throw people off, at least for a little while. So to give you an example of this, the whole issue around contraception, and I'll talk a bit more about that in a moment, but the whole issue around contraception was pretty much fixed in place in 1931 by Pope Pius IX when he, was the 9th or the 11th, I forget, Pius IX, I think, when he put out his document Casti Connubii, and in there he stated that contraception was always and everywhere wrong, and that's the end of it for the Church. Now, if you know a little bit about the politics of it, the year before, the Lambeth Conference of the Anglicans had allowed contraception for some very strict purposes. And so this was the Catholic response to saying, no, no, we've got the truth, and this is it. It has a huge effect on Paul VI when he writes Humanae Vitae, because he doesn't feel in conscience that he can change the teaching of the Church. But you see how the Pope says something, and that's it. Most of you have probably heard the phrase at one time or another, Roma locuta, causa finita. Rome speaks, that's the end of the topic. And this was the way things were up until the Second Vatican Council. And I can remember when I was a student, and I would be mixed in with some of the Redemptorists at our gatherings and our chapters and whatnot, and issues would come up like contraception, and the young bucks would be rebels and trying to stir things up. And I can remember time after time, some of my older confreres saying to me, just send a letter to Rome and let them solve it. And that'll be the answer, and then we don't have to worry about this and we won't fight about it anymore. But it was almost as if we were not allowed to think. We were just supposed to follow these things. And of course, the great virtue at that time was then obedience and loyalty. And that became a calling card over the next 40 years. Absolute moral prohibitions began to proliferate. That was another problem. So I can stand up here and I can say, I think we should never, ever allow the killing of a human being at the end of life. We can look after them, we can provide proper palliative care, we can make sure that they're not horrible pain, we can do all kinds of things, but we should never kill a human being. I believe that that's an absolute moral prohibition. I don't believe that about artificial contraception. But how do you argue those things? The problem is that you start to get into the arguments, and then you get those that are saying, well, it's already decided. You can't use artificial contraception. That's the end of the discussion. And then it becomes stretched in ways that are really kind of difficult to understand. Paul VI was talking about using artificial contraception in marriage, because that's the only place sexual intercourse is legitimate in Catholic theology. But what do you do when you're a prostitute? What do you do when there's HIV in the air? What do you do? All of those are the kinds of things that moral theologians were raising and saying, we've got to find some ways to get around this thing. This just doesn't make sense. And the more the moral theologians spoke, the harder the moral absolutes came down on us. And some of them in the documents, there was a whole almost conversation going past each other on these things, where Pope John Paul II, for example, in his document, or his encyclicals, Veritatis Splendor, the Splendor of Truth, and Donum Vitae, the Gift of Life, he was absolute that these absolutes were necessary. And you can kind of understand why he's so strong on this, because what he's recognizing is that in our world today, there is this awful sense of relativity, which is, well, you've got your ethics and I've got mine, so what's the big deal? You can do whatever you want. And what he was convinced was that we needed to teach people the truth, and if you teach them the truth and they follow it, then they will be safe. But the truth sometimes just isn't capturable in generic statements that hold in every situation. And this is one of the areas where my own personal understanding of John Paul II is that he was a systematic theologian. He wanted things clear, he wanted them to be accurate, he wanted them to be the truth. When you get into moral theology, it doesn't work quite that way, because you have to apply the principles to the situations that you live in. So when I finished my doctorate and I came back to Canada, I was thrown into the world of healthcare. I was asked by my provincial to go around to Catholic hospitals in Western Canada. Most of them were still run by the sisters, and find out what the ethical issues were and whether I could help them deal with some of those. Most of the ethical issues, this had been in the 1990s, were end-of-life issues. Could we, for example, withdraw treatment from a man or a woman who's on a ventilator, and the ventilator is the only thing keeping them alive? Could people refuse chemotherapy if they had cancer? There were all kinds of huge issues that were popping up, and there weren't a lot of clear answers that would come from Rome. There were answers. There were times when they put things out pretty clearly. But it was interesting for me because I couldn't walk in as an ethicist and say, well, you have to do this or you can't do that. I mean, there are things that are just wrong and you don't do, and there are things that you have to do, which is part of the identity of your particular job. But most of the decisions that we dealt with were somewhere in the middle. And in the middle, we had to find out, who is this person? Where are they coming from? What are the factors in this person's life? What are the circumstances around this particular disease? What happens? Well, just to give you an example of the kind of thing that I would run into and just was way, way beyond me when it first happened. I got a phone call one day from a surgeon. I was at a conference in Toronto. The surgeon phoned me. It was about 8:30 in the morning. And he said, Father, are you the ethicist for St. Paul's Hospital in Saskatoon? And I said, yes. And he said, well, I'm a surgeon there, and we have a very troubling case on our hands. He said, we have a woman who is 6 months pregnant with a child that has Potter's syndrome. Anybody know what Potter's syndrome is? Most have never heard of it. I said, what's Potter's syndrome? He said, it's a baby that has no lungs and no kidneys. And I said, well, when it's born, it's going to die. Very good, he said. Can you tell me if it's possible for us to induce an early birth knowing that the child's going to die? Now you think about that for a moment. How do you answer a question like that? You don't have an answer. You've got to start asking questions. The first question I asked was, what does the woman think about this? The woman is most distraught. She's very upset that the child is going to be born dead, and she just, in a sense, wants to get it over with. Well, that sounds like an abortion, except once the child is born, if it's born by an induction, it's born naturally. Does that make a difference? Do you see how you start to get into these really complicated and difficult situations? And it's not like some answer pops out. You work with the surgeon, you work with the woman, you work with other colleagues, you do a little bit of research. And I remember doing some research and finding 2 articles by Kevin O'Rourke in the United States, who was a wonderful moral theologian in the world of medical ethics. And he had written 2 articles that allowed for early induction. And he had really good reasons for that. And so I basically talked with the surgeon, and I said, the one thing that we want to make absolutely clear is if we allow this, and we're going to say, yes, this is a possibility, I want you to find out what the woman herself thinks about it. Because we don't want her at 9 months pregnancy, after she's terminated at 6, we don't want her saying, well, if I had only hung on to the baby, it'd be okay. So the doctor had to sort that out, not in accord with whether he would do the induction or not, but whether this meant something to the woman that was reasonable, ethical, however you want to put it. And those are the kinds of things that we dealt with on a regular basis. But in the meantime, out of Rome comes more and more stringent affirmations of absolute moral principles. We struggle with those. Some of them, like I say, I agree with. Some of them I really struggle with. But the problem is trying to get into a conversation about these things. And the conversation often gets derailed, not because of the moral issues, but because of the issues of authority. When you think of humanae vitae, and you think of, for example, couples that are going to get married, one of the things that they have to do in the marriage course is have an examination of whether they're going to use contraceptives or not. When you ask a question, what has that got to do with discipleship? Well, it's following the teaching of the church. It's the truth. It's the, however you want to express that. But think about that for a moment. Wouldn't it make a lot more sense to talk about, and I will give you an example of this in a moment, to talk about the virtues that really make a marriage work, the kind of listening skills that you have to develop, the kind of gentleness and tenderness that you have to show, the kinds of virtues that are really part and parcel of a good marriage. Do you see how that would make such a difference for us? And yet over and over again, we find ourselves struggling with this, what some moral theologians call this moral pathology. The other thing that's really striking is that as the world changes, we've got all kinds of things popping up on us, and we don't really know how to deal with them. Even when we say, well, we need to go back to the scriptures and get some direction from them, how do you deal with things like the internet? How do you deal with, I mean, I get on the bus and I go to work and I see 90% of the people just on their iPhone or it's a world that they live in. It's not the world that I live in, but who am I to talk to them if I haven't stopped and listened to them and what they're doing? And this is the part that I think is really important. When we get into the world of genetics, for example, you saw that this 23andMe now had this, 15 million DNA samples are now sort of in the public forum. That's who you are. You can't take that away. When we talk about things like, this is old stuff now, Dolly the sheep and cloning. Today we're talking about artificial intelligence. How are we supposed to approach these things as Catholic ethicists if what we've got are these absolute moral norms which never in a million years thought about these particular circumstances? Well, what I think we have to do is start conversations again. I better hurry up here. So let's move on in a new direction. Given that at the 300 years before the Second Vatican Council, the manualist tradition had taken over and just identified sins and the application of sins, there were voices that were trying to counter this in the world of morality. Just to give you some examples, there was a priest by the name of Fritz Tillman, who was born in 1874, and in 1912 he had become a scholar, a scripture scholar. And if you know anything about the history of the church, that was the time of the more modernist crisis when Catholic scripture scholars, particularly following Protestant scripture scholars, were trying to come to terms with literary genres and with the human side of the scriptures. And Fritz Tillman was censured and silenced. But he was given the opportunity to continue as a theologian in another field, and he chose moral theology. And God bless him, because he became the foundation of a whole new set of voices in moral theology, because he built his moral theology not on sin, but on discipleship. And that became a spark for others. Gerald Gilman, in 1952, he wrote his moral theology based on the primacy of love, not the Ten Commandments. Dom Odo Lawton was a historian, and historians often reveal things that we need to understand for what we are and who we are. And in there, he rediscovered the virtues in morality which St. Thomas had explicated in his theology. And then he started to develop a sense of morality as a place where the most important preparation we can give for discipleship is the formation of conscience. And how we do that and what we do with that is really critical to where we go from here. Then in 1954, Bernard Herring, another Redemptorist, put out his 3-volume series, The Law of Christ, which by about 1961 was just on the verge of being put on the index. In other words, we were not supposed to be able to read it. But then the Second Vatican Council came along, and he became one of the advisors at the council. So, pardon me for that long historical introduction, but what I'm trying to get at here is that when we go back to moral theology, there are different perspectives that we need to take into account. The whole thing of spiritual direction with the Irish penitentials, the debates and the discussions about what really are sins and how you apply them in the scholastic era, the casuists and the debates among equals trying to sort out what's the best way to do things. And then, of course, the manualist tradition, which became sort of fixated on these things. The Second Vatican Council avoided moral theology except for one comment. In the decree on the training of priests, this is what is said. This is the only thing about moral theology in the Second Vatican Council. Special care should be given to the perfecting of moral theology. Its scientific presentations, in other words, getting the facts right, should draw more fully on the teaching of Holy Scripture and should throw light upon the exalted vocation of the faithful in Christ and their obligation to bring forth fruit in charity for the life of the world. There's a summary of what a moral theologian should be doing and what the people should be absorbing to fill the world, basically the kingdom of God, with the charity of God. However, in the background is artificial contraception. Paul VI had denied permission for the Second Vatican Council to even debate it. He reserved it for his own deliberations. He put together a committee to examine this of 64 people, developed a little bit over the years. 60 people came out in favor of changing the teaching on artificial contraception, and 4 fairly conservative moral theologians argued that this would destroy the ability of the church to teach because it would show a change in what has always been taught, which is non-historical, but that's the argument that they used. At any rate, what happened after Humanae Vitae was 40 years of battles over the laws. Is the law, now notice what has to happen here. Is the law, thou shalt not use artificial contraception. Artificial contraception is always wrong. If you challenge that law, does the law disappear? It's almost as if there's no middle ground where you could say, well, it makes sense in certain circumstances, but it doesn't make sense in others. Maybe we can debate those things. No. You need to keep the law because if you open the door, look what will happen. Do you believe me? Take a look at medical assistance in dying at the present time. Medical assistance in dying started with, oh, these poor people, they're in horrible pain, and we need to help them get it over with by ending their lives. That was just opening the door, and now you just be patient and see how many people we at the end of life will end up killing. But I don't want to go there. What I want to do is I want to talk a little bit about the new ways of approaching moral theology in our church today. And the very first thing that I want to do is I want to focus on who is doing moral theology today. Think about that for a moment. Up until the Second Vatican Council, it was all done by clerics. Everything. It was all done by priests, and it was focused primarily on the confessional, but the moral teaching slipped out into our Catholic way of understanding our faith. And so people knew what the teaching of the church was. And I remember they knew some of the teaching. I remember a young girl coming up to me, not in confession, so I can say this, and she said, Father, I think I need to go to confession because I'm using artificial contraception. And I just blurted out, I said, are you married? She said, oh no. It's just like, that wasn't the issue. The issue was what the church taught. That was the issue. But who are the moral theologians today? One of the wonderful things that's happening in not just moral theology, but in theology in general, is that there are more and more women getting involved, and they have very different perspectives on what's important and what needs to be dealt with. The first women to get into moral theology, and I mean at the doctoral level, were in the 1970s, and they were almost all religious women. And then they began to, if you will, stand with the church, but challenge the church on all kinds of different things. The next group that started to get into moral theology were married people, husbands and wives. And this started to change the face of moral theology because of their interests. Let me give you 2 very simple examples. Richard Gallardi was a very good friend of mine. He died November the 7th, this just past month. He wrote a book called A Daring Promise, A Spirituality of Marriage. Now, when he wrote this book, there were all kinds of books being written by priests on the theology of marriage, comparing it to, like in Ephesians chapter 5, it's like Christ and the church, the bride and the groom. You know, there's this union and it's indivisible and so on and so forth. Gallardi said, that's nice, it's really pious and it's wonderful, but believe me, he said, when you live in a married relationship, you can't use the romantic notions of clerics to figure out how to make things work. And he said, very simply, I wanted to write about what it's like to live as disciples in the relationship of marriage, and what that discipleship would mean for us in terms of the sacrament of marriage. The sacrament is where Christ is present. So what does this mean for us? And a couple of quick things that he did was he pointed out that this was a spirituality, which means a pathway of discipleship. How do we work this out? How do we pray together? How do we live together? And one of the things that really caught my attention were 2 things. One was, he said, you have to learn in marriage an asceticism. Now, asceticism we sort of associate with monks in the desert and stuff like that. No, he says asceticism means you've got to learn to let go of your own wants and desires for the sake of the beloved. And then, of course, when the children come along, there's a whole other dimension to that. The other thing that caught my attention was, he said, you know, we praise monks and priests and religious women who are virgins, and we make them saints. And he said, what about married couples? They're the ones that carry the church, basically. They're the ones that give us an identity of what the sacrament of marriage is about in terms of salvation. So you could start to run with that to all kinds of things, but I just wanted to point that out. The second example comes from a theologian, a woman theologian by the name of Julia Hanlon Rubio. And the title of her book, she has two of them actually now, but the title of her book that I saw was Family Ethics. Now that might sort of make you scratch your head a little bit, but for me, it really paused my thinking when I looked at that. I said, what do you mean family ethics? What are we talking about here? And again, what she's talking about is discipleship. How can our family be a model of discipleship? And she talks a little bit about praying together and things that we'd sort of normally assume with that. But then she goes into the things that make a family of disciples. For example, meals together. Sounds very simple and it sounds very archaic for a lot of people, but meals together are where you talk, where you share, and where you imitate the Eucharist. She talked about hospitality, about reaching out to others and bringing them to your table. Excuse me. She talked about communication. She talked about all kinds of things. And you see this then, ethics is the term that kind of captures this. How do we do the best job we can to be the people we want to be, which is disciples? And that's where our ethicists are going today. The third new face in the world of ethics is the international face around the world. And here I give enormous credit to a theologian by the name of James Keenan in Boston College. About 25 years ago, James Keenan realized that most of our moral theology is from North America or Europe, and it's very Eurocentric in the Catholic Church. So he started to reach out to ethicists, primarily in Latin America, because there were all kinds of ethicists involved in liberation theology. And he began to discover that there was a whole coterie of ethicists in Asia and a bunch in India that were teaching sometimes in seminaries and sometimes elsewhere. Then he began to discover that there were people in Africa who wanted to get a PhD in ethics so that they could teach in their own educational institutions. And what he did was he established what's called the Catholic Theological Ethics in the World Church. What he does is once a month we get a newsletter, and it's got articles from all over the world, people that are dealing with the topics that are in their local circumstances and things that they're dealing with, and dealing with it in a way that is often creative and loyal to the church, but without being sort of narrowly Eurocentric. It's a fascinating world. And he's had conferences in Siena, in Trent, in Sarajevo, every 4 or 5 years, where he brings theologians together from all around the world. And the only way he can do that, I know the very first conference he had to raise $750,000 to be able to enable ethicists from third world countries to be able to fly and stay in a place like Siena. But he put his heart and soul into the thing because he's convinced that this is where the future of ethics is going to be. So I'm just a couple hours from the end, so just relax, okay? Those are the who's. Who's doing ethics? The women, the married people, and the international community around the world. Now what I want to do is spend a few moments just on some of the consequences, and I'll try and hurry through this. If you have questions, you can ask afterwards. But first of all, there's a huge movement now away from the law as the cornerstone of ethics, trying to get the laws perfectly clear. I'll give you an example of this. I used it, thou shalt not kill. You'd think that that would be an absolute moral prohibition, but it's not in the tradition of the church because of capital punishment, self-defense, just war, and indirect killings. So if you want to keep a perfectly clear, absolute moral norm, you have to clarify it. So the norm that comes out from the Vatican now is, it is never permissible to directly kill an innocent human being. So now you've got an adverb and an adjective in there. Innocent and directly. What does that mean? Well, you can't do abortions because those are people who are innocent. You can't directly kill anybody because that means you want to kill them, and that's just not permitted. And so you've got an absolute moral norm, and that's the end of it. But I want to ask you a simple question, and this actually happened in Phoenix. If you have a woman who is pregnant, say is 11 weeks pregnant, and the pregnancy is causing her blood pressure to go through the roof so that it's almost 100% certain that she and the fetus will die, could you do a direct abortion? And the answer is no. Sometimes, to protect the innocent. Like if you let one exception in there, you're going to open the door, and then look out, you're going to justify abortion. That's because of the relativity. Moral theologians and others have always reacted to these things and said, wait a minute, there's something wrong here. We have to find a way to establish the validity of the exception. And then off they go and they start to work on that. And over and again, things get shot down from Rome. Just to give you a very funny example, as funny as not funny, but an example of this, the Jewish tradition, which is very similar to the Catholic tradition on abortion, which is the really serious Jewish tradition, there's no abortions. And what's interesting is to watch how they allow a direct abortion if the fetus is endangering the life of the mother, like in the case of this high blood pressure. And they argue that the fetus is no longer innocent, the fetus is attacking the mother, and therefore it's justifiable to remove the fetus. One of the Catholic theologians proposed that as a possibility, and within weeks, there was an answer from the Vatican. It was still a direct abortion and it was not permitted. So excuse me. So the question that gets raised is, do we just let the woman die? And the irony is, if you did that in a Catholic hospital, you'd get sued and you'd probably lose everything, and in my opinion, justifiably so. But how do we find a pathway around that? One of the things we have to, I think, go back to is the softening of the law. What I mean by that sense of ut in pluribus. And we have to spend a lot more time on virtue ethics. And I'm just full of examples on these things. But one of the things I just wanted to point out to you, when I started teaching at St. Paul's Hospital in Saskatoon with the student nurses that would come, and they would spend 3 months on rotation. They'd spend 2 months in the emerge and 2 months in the ICU and 2 weeks. And after they'd been there for 6 weeks, I would sit down and I would talk to them about medical ethics and what they had to know about patient-informed consent and so on and so forth. And then I would ask them a very simple question. You've been here for 6 weeks now. Have you seen a nurse that you would like to imitate? I never had a student say no. They all could point out at least one nurse that had really stood out for them, and when I would ask them why, they would say, well, I couldn't believe how she listened to the patients. You know, even if you go back to Socrates, the question is, can you teach virtue? The answer is, you model it. And that's one of the things. And if you stop and think about it, that's how parents teach their kids. I mean, parents use rules, but they don't use rules as if that's the only thing that exists. They're teaching their kids to be good, to be shared, to be willing to share, to do things that'll make them a good adult. And this is what we need to do as Christians. But I'm going to take this one step further and apologize for being a little over time here. I want to say that we also need to think about community virtues. What I mean by that is, as Christian communities, do we really pay attention to something beyond our individual virtues? I can be generous, but can the community be generous? Go back to all of the letters of Paul and Peter and James, and you will find in every one of those letters an exhortation to the Christian community on ethics. And it sounds like this. This is from Colossians. Because you are God's chosen ones, holy and beloved, clothe yourselves with heartfelt mercy, with kindness, humility, meekness, and patience. Bear with one another. Forgive whatever grievances you have against one another. Forgive as the Lord has forgiven you. And over all these virtues, put on love, which binds the rest together and makes them perfect. Dedicate yourself to thankfulness, and whatever you do, whether in speech or in action, do it in the name of the Lord Jesus. Does that sound like our communities? We do get glimpses of those things. Don't get me wrong here. But that should be our model, if you will, of living ethically. Now I'm going to skip through these others very quickly. I think we have to move from individualism and individual acts, and particularly sexual acts, into relationships and what that's going to mean for how we adjudicate various actions in people's lives. I think we need to develop ethics in accompanying disciplines. For example, I call myself a clinical ethicist because I've done 30 years of work in hospitals. I'm not an academic ethicist. I've never, well, I should say I've taught a few courses, but I've never had the time to sit down and write a book. But I've just marveled at what I've learned and what I've been involved in as I work in hospitals and nursing homes and other areas of healthcare. And I remember one real interesting comment that I got about 6 months after I'd been at St. Paul's Hospital in Saskatoon, and I'd sort of wandered around and talked to people and tried to figure out what they were doing and what the ethical issues were. And I sat down with a group of nurses, and one of the nurses turned to me and she said, we didn't know what to expect when we were told that this priest was coming to be an ethicist at the hospital. And I said, what do you mean? And she said, well, we were absolutely convinced that we were going to get a moral policeman. Doesn't that sound like enforcing the law? And then I got the best compliment I've ever had. She said, but you just walk with us. That's ethics. I think also this approach to ethics means that we can open our hearts as Catholics to the ethicists in other Christian denominations, in other religions, and anywhere ethics is being done. And we can find pathways that we probably never thought of before because other minds look at it from different points of view. I think as ethicists, we have to reinvent the art of listening. When you stop and think for a moment, was the Catholic Church at the head of anti-slavery movements? Was it the head of helping women to get established equally in society? I mean, I could go on and on. We're always playing catch-up because we think we've got things settled already. And the world moves on and we need to kind of catch up to it. So what do? Well, let's spend the first part of the time listening. This whole issue of transgendered people is coming up. Most of us have never met a transgender person that we know. So why do we have opinions about them? We've never stopped to listen to them. That's where we have to go. And of course, if you take this one step further and start to move in the direction of social justice, the next question is, how do we start to learn to listen to the people on the margins? That's got to be where we put our major effort as ethicists. Brief comment on synodality. I think this is what Pope Francis is trying to do. Let's become listeners and let's talk to one another and see where it takes us. And ultimately, I think we're going to have to recognize that there will still be resistance within the Catholic Church because there are lots of people that want clear, safe answers, and that would be the end of it. So let me finish very quickly here. I want you to think for a moment of Christians in every field of endeavor. Let's take the university. Could a Christian, a Catholic, be a physicist and bring some dimension of faith into his physics lectures? I mean, most of us say, oh, no, that's just physics. Well, watch and see what physicists sometimes do when they dismiss creation. Their understanding of creation is either creation or evolution. Our Catholic tradition sees the two of them as complementary. Does a physicist know that? Can he share that with somebody? Now multiply that down the line. Go to social work. What difference would it make in social work? What difference would it make in economics? We've got all kinds of business ethicists that are popping up now. I think there's some real possibilities there for ethics to explore and expand in specialized ways, specialized fields. Couple of quick conclusions, honest. I used to have a priest that we would preach on Sunday and he would say, now in conclusion, 7 times, then we knew he was done. I would like to see, and I'm taking this from Pope Francis, that from now on, ethics should not be concerned with sins and the pathology of sins. I mean, we have to deal with those things, what's wrong and how we deal with them, but I think we should focus our attention on dealing with issues of suffering in our world. Because if we can start to face those issues, we're not going to find answers for most of them, but we're going to find that we can bring a compassionate heart, we can bring those virtues to bear so that people know and feel that they're not alone. Pope Francis, in his document Fratelli Tutti, validates the ethicist's new purpose. For him, it is a commitment to respond to human suffering. Moreover, we also now have the tools to look at our own history and realize how often we've caused suffering and how we can probably step in and instead of being, the magister, the teacher, we can be the learner and we can also be a little bit humble in our ethics. Finally, we are called, this is from Amoris Laetitia, as members of the Church to form consciences, not replace them. That should be our task in the future. And for those that say, but we need the rules and we need them to be clear and we need them to be absolute, I finish with this little quotation from Paul's letter to the Romans. Owe no debt to anyone except the debt that binds us to love one another. Those who love their neighbor have fulfilled the law. the commandments, you shall not commit adultery, you shall not murder, you shall not steal, you shall not covet, and any other commandment there may be, are all summed up in this: you shall love your neighbor as yourself. Love never wrongs the neighbor. Hence, love is the fulfillment of the law. And believe it or not, I'm done. Thank you very much.
Father Mark, thank you so much.
Are you on?
Is it on?
I don't think.
It's on.
Oh, now
It
it's
is on. Yeah. Thank you so much. That's wonderful. And as a biblical scholar, I really appreciate the way you ended the talk as well with Romans. It's wonderful. So we do have time for some questions, and I can bring the microphone to you so that your questions can be heard by everyone. So if there is a question for Father Mark, a lecture filled with so much clarity in the midst of complexity as well. So thank you so much. I do see one question at the back there.
You know, that's a great question, and I can't say much about it because I don't know it very well. But I remember one thing that really struck me when I was helping with confessions at we have Ukrainian Redemptorists in Saskatchewan and Manitoba. And I was helping with confessions one day, and the Ukrainian Catholic priest came up to me and he said, by the way, he said, remember that when our people come in, they don't say, bless me, Father, for I have sinned. They say, bless me, Father, for I am a sinner. And I thought that's just profound, because when you go into the confessional, you're a sinner. When you go out, you're still a sinner. But what you are is a sinner who's experienced the mercy of God. And I think when I read John Chrysostom and some of the great Greek fathers, their sense of mercy was just overwhelming. How it played out in terms of the confessional, I don't know. I haven't studied that at all. But that's a good question. Anybody else? Another question way at the back. I think you're absolutely right on that, and I did skip through that very quickly because I was already over time. But I think what happens when you look at suffering and you start to look at where it comes from and why it's there and what responsibility we have, that's where exactly the issues of sin, and not just personal sin, but also the social sin that gets fixed into structures and things like that. And that's where I think our liberation theologians have been absolutely masterful in helping us to understand it. Not only them, but the feminist theologians and others along those lines. So it's like that would be a whole other talk to move in that direction and begin to understand. But I agree completely that you can't talk about suffering as if it was some kind of I don't know, devotional thing for us to be a part of. It's a challenge. It's a challenge to the reality of God, quite frankly. So I do think you're right on there.
There are a couple of questions online. I'll ask one of them to start, Father Mark. Thank you for the beautiful talk, Father Miller. What do you recommend to those who rely on practical applications do, for example, policymakers in Catholic-sponsored organizations, when there are differences between moral theologians on certain topics, such as contraception or gender? And I guess the question is, how do you adjudicate between different moral theologians?
I'm not sure you can adjudicate sometimes, because today they tend to go into two different camps, and the result is it's a bit like the polarization in our society. You're not sure you can get a conversation going. But what I've found very helpful is, like when I work in our Catholic hospitals and long-term care facilities, I always make it abundantly clear what the teaching of the Church is, because it is clear. And for a lot of people, that's what they want to know, and that's what they want to hear, and that's the end of it. But then what I do is I try to give some arguments that show that maybe the teaching needs to be adapted or adjusted a little bit. And you have to be very careful with that, because it's very easy to, quotes, betray your bishop by saying, well, I don't believe in that stuff. I'm not interested in that. What I'm interested in is dealing with the suffering of people and seeing if we can find ways to make it whatever the intervention might be, to make it work for them. And that's a bit of a tricky dance, because I remember talking with a friend of mine who's a moral theologian, but in the academic world in California, and he kept saying to me, "Why are you concerned about those things? What's the big deal? Just, come right out and challenge the church." And I say to him, if I did that, I wouldn't have a job. And it's not that I'm married to the job, it's just that there's a whole structure, if you will, partly sinful, that we have to attend to. And if you'll notice how Pope Francis deals with these things. You remember the famous line on the plane where somebody asked him about homosexuals, and he said, "Well, who am I to judge?" I think that was a brilliant answer, because what he was saying was, if we're going to be moral policemen, here's the morality, and then we just dump it on people. But if you get inside people's hearts and see what's going on there, if you can, you're going to be a lot more humble about how you approach those things. And that's what we try to do, I think, in our situations and circumstances. So to give you an example of that, I mean, this whole issue of MAID in our Catholic hospitals, bishops are adamant there will be nobody killed in our hospitals. But what do you do when you've got somebody who's very, very sick and who wants MAID? And how do you take into account your care for the patient and your moral stance? That's what we're all working on, let's put it that way. So, good.
I'll ask one more question from online, and then check again
Okay.
in public with the audience in person here. Are there any notable websites or books on moral theology that address these contemporary issues that you could recommend to people?
Oh, there's a ton of stuff coming out today. I mean, you've got all kinds of books on virtue ethics. You've got books on doing ethics from the margins. You've got books on feminist ethics, and all of them bring different perspectives and different insights together. And depending upon what your interests are and where you're going to apply it, there's certainly all kinds of literature to go to. Now, I have to give a qualification to that. I'm a book guy. So when you say, what do you find on the internet? I say, well, I'll be lucky if I can get my email out. So it's an awareness that there's all kinds of stuff on the internet, but there's all kinds of nonsense on the internet as well. And if somebody would like to follow up on the talk that I've given, there was a book published by James Keenan last year called, I've got to get the right name for it, Catholic Theological Ethics, an introduction. That doesn't sound right. Something about, but the title is Catholic Theological Ethics. In other words, he's moving it from moral theology to this broader field of ethics. And then at the back of the book, he's got a huge bibliography of every kind of theologian that's working in the field today. So that might be a place to go.
Any other questions? Yes.
Well, just to give you a very quick response, I think we need to do a much better job of educating our Catholics about what a good death is. We need to educate them about the meaning of palliative care. There was a palliative physician before all of this stuff with MAID started, a palliative physician in Quebec who went to the legislature and said, we don't need to kill people, we can look after them. That's been totally dismissed and forgotten, it's gone. And what you need to understand is that I think as Catholics, we need I don't want to say a theology, we need a spirituality around the dying process, because it's so complicated today with all of the interventions that medicine can make. But we need to understand something about what it is to be human when our abilities, our physical abilities, our mental abilities, our other abilities are declining. To me, I would pursue a whole spirituality where we see that as an invitation by God, an invitation by Christ to let go of our own independence, our own self-centeredness, and trust that God is there looking after us. But you have to have good palliative care to do that, because if you're in pain, your spirituality goes out the window. So there's a whole pile of things there that we need to kind of focus on. And I think we need to do that in our communities as well, because I'm starting to hear people say, well, you know, I know somebody in this community and they committed MAID and nobody seemed to be upset about it. It's not a question of being upset, it's a question of making choices that I think have to do with our lives as disciples. So that's a partial response, shall we say. Okay? I think what you'll find is that there are next to no doctors that consider it murder. If they're going to do it, they do it because they think it's compassion. They think it's the right thing to do. And most of the doctors that I've talked to that are in favor of this, they don't want to talk much about it because they're not going to think about it very much. They simply use this argument, which I find really difficult, which is this is what the patient wants. And I always say to them, there's all kinds of people who want to commit suicide. Why do you help these? Well, they're dying. So basically that means I make the judgment as a doctor that their life isn't worth living anymore, which I think is just a total abandonment of the patient. But it's like you said, you know, there's 73% of Canadians think that MAID is a wonderful idea. They don't know palliative care. They don't have any theory of life at the time of dying. And the really troubling part is that there's been so much misinformation. You know, the Euthanasia Society has been working for 80 years and saying, oh, you don't need to die in pain. We can get this over with. And we haven't countered them. How are we doing?
I think we are doing great. I think you have done wonderfully. And I think there are so many questions about these various topics that impact us all on a day-to-day basis. And I thank you for expanding our understanding of that and for bringing us back to the gospel. I really do appreciate that. And I'd like to ask you to warmly thank our guest again, Father Mark Miller.